Good morning, I am Dr. Sharifah. In this reflection, I will discuss how I would manage a given scenario in which I am on a busy walk round and notice a nurse preparing to administer an IV antibiotic. The patient expresses concern and states that they previously had an allergic reaction to the medication. And after checking the chart, I confirm that there is a documented severe allergy previously. At this moment, my foremost responsibility is to protect the patient from harm. I would first step in promptly but professionally. I would approach the nurse calmly and say something like, "Let's pause for a moment. The patient has a documented allergy to this medication, and we need to verify before proceeding to administer the medication to the patient. This action will protect the patient, prevents harm, and maintain respect for my colleagues, especially in a busy and stressful ward environment. I would reassure the patient and thank the patient for speaking up and ensure that they feel heard and safe. And to comply with the clinical standards and regulations, I would double check the record, notify the treating doctor regarding the previous history of severe allergy to the medication, and document the near miss incident according to the hospital procedure. And this action aligns with the medication safety framework and guidelines, including the principle of duty of care and expectation to report any potential error. And throughout this situation, my communication will remain supportive and blame-free, because a respectful tone helps maintain a positive working relationship while still being assertive about safety concerns. Ethically, my action is guided by non-maleficent, in which preventing harm, beneficent, in which we are acting in the patient's best interest, autonomy, in which we are listening to the patient's concern, as well as professional accountability. After the incident, I would participate in improving safety systems, for example, reinforcing allergy alert processes, encouraging double checks before medication administration, and promoting a culture where staff can feel comfortable in raising concerns. And education and system checks are key to prevent similar events from happening. So, in summary, my response prioritize patient safety, clear communication, adherence to the professional standards, as well as ongoing learning. Acting promptly and respectfully allow us to safeguard the patient while supporting a collaborative and safe clinical environment.